really thank you the kind invitation of Professor Silvana Kaczynski to this wonderful meeting about telemedicine, innovation, and entrepreneurial. Our university, and I will show you, and I will introduce myself, is Tecnológico Monterrey. Tecnológico Monterrey is the largest non-profit private university in Mexico and probably in Latin America. We are around 26 cities all over Mexico. And I'm at the Dean of School of Medicine. I'm the president of the Mexican Association of Faculties and School of Medicine. I'm an ophthalmologist and a cornea and refractive surgeon, and I have a PhD in surgery research. Well, really involved in medical education and health science education. And I would like to talk today about the new digital competencies in health. And you will see how related it is to the previous talks, and it will make a lot of sense what we were talking. This is a small editorial paper I wrote some time ago, but today we are facing a paradigm shift in medical thinking. It's no longer a success or we consider like successful just curing the disease. I think the new paradigm is maintain the health. And as you see in the previous talk, a lot of advances, discoveries, and new technologies, innovations in the combined use of them allow us to really to think quite different for the future. Let me get into that, because the future is no longer what we used to think about it. For example, this is a typical image of a robot when I was a kid, and see how even the images have changed. And the future is our new station. The future is here. We will call it the information age, but we are facing a new era. We are moving from the information age to the biointelligence age, and we have to take that in account. The future is around the development of the biology, physics, and information. And through what? Well, with the convergence between biology and informatics, we will have the genomics, bioinformatics, computation. But for example, in the merge of biology and physics, well, as we see previously, biosensors, biomaterials, biomimetics, for example. So for the future, what is the future? It's for the entrepreneurs. And I have seen some images of new entrepreneurs here in the previous talks. We have the inventors, the pioneers, and the innovative people. But when you bring all together, you become an entrepreneur. And that's very important, because the future is made through that. And but we have to see what are the drivers for the change in healthcare. We have the internet, the beginning of the information age or bioinformatic age, globalization, cost containment, large buyers, managers, and increase public accountability of all the institutions. The question is if we as professionals, healthcare professionals are prepared for this digital transformation. And the answer is no. The healthcare field is the digital transformation is occurring very slowly. If we compare with other sectors that are moving forward faster than us. So we need to increase our velocity of change. That's very important. And how we incorporate innovation. And I will talk about it a little late. I would like to just talk a little bit about what is digital health. Digital health is the concept that incorporates, as we see previously, information and communication technologies into healthcare products, services, and processes, as well organizations or institutions that can improve the health and well-being of the citizen. Digital health is the new global paradigm for the provision of effective, equitable, high-quality health services with great human sense that allows connecting the person and their family with the health units and their community, and with a transparent performance measurement schemes with accountability. What includes the digital health? Well, digital health includes the convergence of digital technology, digital technologies that allow us to do personalized and accurate medicine, the use of information and communication technology, hardware and software solutions, and as we see in the previous talk, interconnected health systems. Digital health is when you develop a technology that facilitates the health treatment of a patient as a part of the therapeutic approach that you are having. In that sense, e-health is a branch within digital health in which you have electronic medical records, telehealth that you have been talking about, e-learning that we are actually using. So everything with a concept of standardization and interoperability. You will see how many things are around e-health. And about talking about e-health, the World Health Organization create this resolution in which they say that we need to facilitate the integration of e-health into the health systems. How we do that? Well, we need to develop interoperability, legal and regulatory framework, evidence, human resource. But I want to point out that there's a lack of technical competence on digital health. We need to develop digital health within the curriculum, formally within the curricula of the health care professions or medical schools, and also in the training of the health. So there is a fundamental concept, new technologies that are emerging of discoveries of the information age are conditioning our approach, our traditional approach in all areas of education in medicine and health science. And let me get into the education part because we have a new paradigm ahead. And that I would like to ask, what are the key competencies that a health professional, a doctor, a physician, need in this new digital era? And we need to talk about the future of learning. The way we learn in the past is not longer useful. As we learned yesterday, is not. It is insufficient today. The experience of those who learned yesterday does not necessarily serve us today and will hardly serve us tomorrow. There's this way think that we have, the physicians. We think the way we learn is the way we must teach. And that's just repeating our biography. In medical education, that is not true. We need to move forward. And let me show you how is happening that. We are moving from that curriculum based on science that has been here for over 100 years, since the Flexner reports many years ago in the United States. Then in the past century, in the 20th century, we moved to problem-based learning. And now we are moving to system-based learning. And we are moving to competencies learning. And I would like to talk a little bit more about this, talking about competencies, how we develop competencies. But moving to that, to this point, from scientific approach, the typical basic science, clinical science, very old approach, to the new model, really we need to create a culture of change, of a culture of innovation in our schools. And that's very difficult in medicine. More than 10 years ago in Mexico, we developed the competence-based profile of the general practitioner, in which we develop all these competencies that a general practitioner in medicine must have. In moving forward in that same pathway, we recently published, my team, we published this paper about the development of what we call transversal competencies or general competencies. And I want just to bring your attention to this at the personal level, in which we really declare that we need to develop a competency on the use of information and communication technologies. And we talk about, we start to talk about what we call digital medical education. That has a lot of impact on the students. During the pandemic, we were forced to use it and incorporate that to our everyday work. But it's not, when we talk about digital medical education, it's not just to use the Zoom or any other communication technology. It's really to incorporate technology in the training of the healthcare professionals, in particular the physicians. And in the same way, like any other educational activity, we need to create our objectives, in which we follow the same, emphasize generation and retention of knowledge, demonstrate the different methodologies, clinical competencies must be developed, recognized online, virtual face-to-face clinical setting, everything else. Even ethical principles, we need to incorporate that. And let me get into specifically the digital competencies. This is a wonderful paper. It's in Spanish and English. It's in medical education. It's free access, in which, following this agreement, this European framework, they create these different areas of focus in order to develop digital competencies: information and information literacy, security, communication and collaboration, digital content creation, and problem solving. From that, they develop the following competencies. First, digital health literacy. Knowledge of the digital ecosystem and obtaining the basic ability to properly and safely use different digital devices and their application. The other digital competence for healthcare professionals is effective management of scientific and health information. We need to be able to manage big data sources in order to really use the knowledge. The third one is the health communication 2.0. Use the digital technologies, devices, channels, and in an appropriate way to improve networking and non-face-to-face communication between health workers. All the systems that we have, from WhatsApp, messages, Zoom, everything that we can use in order to improve our communication. Fourth, creation of scientific health digital content. Taking advantage of information and communication technologies to facilitate and enhance research and scientific publication 2.0, as well as the design of production digital health content. It's more rich. We can do more things when we move from printed to digital publication and creation of content. The other is what we are just doing right now is collaborate networking with health teams. We need to really establish networks at different levels of organization and complexity, and to solve from clinical problems, research problems, educational problems, in order to increase our collaboration. And the last one is data analysis and management. We need to be very able to use the data that we have in order to serve our patients. The use of information in the point of care, for example. If we have electronic records, we have to take advantage of that in order to facilitate clinical decisions, clinical judgment. So these are the 6 basic clinical competencies. From this, in the paper, the authors show how they develop other subcompetencies. Because of time, we don't have time to go through all of them. But it's my suggestion that you can read this paper in order to know a little bit more about this. But these digital competencies does not occur without an educational model. And I'm bringing to you this medical education model that we are using in Monterrey Tech about the patient-centered education. Actually, it's what we call, and this has been published, unfortunately, it's in Spanish, it's center patient learning, in which we have all these perspectives, but you may see this perspective from entrepreneurial, and this course talks a lot on that. It's not only about opening enterprises, but it's how to change the reality, how to really practice leadership. And let me get into that. In the past, we were, when we were using this traditional approach or educational model that most of the medical schools in Latin America still use, dividing basic science and scientific science, the product or the expectative of the graduate was only to be an expert on the discipline. Very high qualified cardiologists, very high qualified ophthalmologists. Then that start to change. Still, we need experts, but we need that they collaborate in an interdisciplinary team. And that's what occurs in the 60s. And then that we develop a professional, a health professional. But today, and I'm circling that and translating that to English, we need leaders that work as agents of change in the environment. And let me talk a little bit about innovation and leadership. Innovation leadership is the ability to inspire productive actions in yourself and others during times of creation, invention, uncertainty, ambiguity, and risk. Pretty much the same times that we are facing right now. Is necessary competency for organizations hoping to develop truly innovative products and services. This course that you organize is really about this. It's about innovation leadership. So I congratulate the organizers for this type of courses. We need a lot more about it. This is the definition of leadership that I like a lot. Leadership is about creating new realities. It's not being a victim of the reality, it's actually change the reality and move forward. So in order to move forward, we need to develop competencies, digital competencies, but also to develop leadership competencies that will fit in an educational model. So we also need to change our traditional approach of education. And that's very painful for the medical professionals. We don't like to change the way we teach. We don't like to change the way we learn, but we need to do it if we would need to face the future. I will quote Sir Ken Robinson, a great educator, that says, what separates good innovation leadership from great innovation leadership is the ability to create, cultivate, and maintain environments where everybody adds fuel to the collaborative fire. So I thank you the opportunity to be collaborating in this course. We need to create more collaboration and innovation. And we need to remember that to be successful in the 21st century for the institutions, we need to be incubators of leadership. And I will say of innovative leadership. And I will end just with these questions, with this question. Are we, the teachers, ready for these new models, for hybrid models? I share with you our last publication in which we evaluate our faculty in the Tecnológico Monterrey School of Medicine, and we are not quite ready. We have some advances, but still we can work a lot on that. So, muito obrigado, muchas gracias. Thank you very much for allowing me to be here. Thank you.